When will the technique manual be completed? Why don't we have a student dress code outside the clinic? I thought we'd have questions on African, South American, China, and that type of thing. Some far-reaching, significant questions. Why can't we have pink toilet paper in the men's restroom? Who put that down, Dean? You didn't put that down. It's here, right on this paper. The significance of the impact of these profound questions of the fifth quarter. What is happening with the Sherman College? I'm not a professional in Sherman College. I don't know anything about the Sherman College. You've got to ask the Sherman administration. You might request of me that ask them to come over sometime. Your colleagues, you know. Someone asked me the other day a similar question on Sherman. And they were saying that the dynamic chiropractor, which is worse than the National Enquirer here, you can't believe anything they say. They had a lot of trash about us in years previous. They're talking about Sherman and the accreditation issue. And one thing we forget, that Sherman basically is a fundamentalist group. I don't think they've related properly with the diagnostic posture. So the dynamic chiropractor was very heavily steeped with criticism about not being a real doctor. They don't even study diagnosis. I don't say that they don't study diagnosis, and I wouldn't want to be critical of them. I just think that they haven't related it properly. And I don't even think that if they look at it historically from the Palmer College, from 1920 to 1940, say 30, 35, we taught chiropractic diagnosis with Firth and Werner for 15 years at the Palmer College. So we can't say that the roots of chiropractic is not in some manner steeped in diagnosis. In fact, in the early days, it was necessary to name the disease before you would go merrically and go down and see if the disease, and you'd pick out the Merrick system up and down the spine. From the disease, they'd go pick out the spot where the nerves was inflamed, because our basic tenet, our basic understanding and our principles of chiropractic were predicated upon the system and where the nerves emitted, because our philosophy said that we cured all diseases. I don't think that's too far off. I don't think we can come out and say that we got the basic cause of all diseases. I think it's improper to do that. You'll be challenged very heavily by a lot in the scientific community. But nevertheless, we have to be realistic when we're talking about our colleagues. And frankly, the Sherman group over here contains a lot of fundamentalist chiropractors. In fact, their group was at one time very closely aligned and very closely associated with the DE group. In fact, Reginald Gold, one of the original founders of Sherman College, one of the supporters who had a following, was on the DE program for 3 years. I went to college with him. I went to college with Gilardi. I went to college with Dr. Umber, of course, Dr. Nail, and Gerald McAndrews, the president of former president of Palmer, and the Dr. Kern that's up there now. He was probably 7, 8, or 10 years behind us, but his brother was a student at Palmer College, and his daddy was a teacher at Palmer College. So we're all related. This whole divisiveness has a lot to do with our particular point of view in chiropractic, this whole disunity of chiropractic. And I think if you look at it realistically, you go back, you really need to look at Volume 1 by D.D. Palmer if you're vitally concerned about the history of our profession. It gives a good picture. If you take the whole volume, there's about 50 or 75 strong positive statements in there about the uniqueness of chiropractic and how the founder wanted to keep it separate. I don't think there's ever been any disagreement with any particular group about whether we weren't aware that hot packs or cold packs or electrotherapy or nutritional therapy or osteopathic therapy or naturopathic therapy or homeopathic therapy wasn't effective. Everybody knows that. Every allopathic procedure that has been known has some effect on some people, on some conditions. We've never been divided on that particular aspect. It's just that when chiropractic come along, there was nothing mentioned in the text, nowhere. And when our founder began emphasizing that structural problems of the spine, which he called subluxations, interfere with the nervous system, and the correction of that was a primal cause. He did say that, and our forefathers emphasized that 95% of the diseases that man could be subject to was caused by structural impediments in some manner interfering with the nervous system's ability to function. Medicine at that time knew that you could impinge a nerve. We had frog tests and all kind of little scientific problems like that where we were saying it. But no one emphasized that vertebrae could become subluxated. And there was a long debate after Palmer began to move about the country and teaching primarily in the infancy of chiropractic other allopaths, homeopaths, naturopaths, osteopaths, masseurs, electrotherapists, mechanotherapists, the new edition of chiropractic. And what the old man, the Palmer, the original over here, what his concern was that you would mix, that's where the word mixer come from, that you would mix chiropractic procedures with these other allopathic, homeopathic, osteopathic, naturopathic procedures, and you wouldn't keep your profession pure. That's where the term mixer come in at. And there was a long ensuing duel, because obviously if you were a masseur or if you were any other of these professions that were long outdated chiropractic, it would be a great tendency just to come in and take the new chiropractic work and then add it to what you were already doing. So obviously when people would go out, there was no chiropractic identity. Here was the masseur, here's the naturopath who did a little spinal manipulating, here's the osteopath, here's the medical doctor, the allopath, right on. And so you had a little piece of chiropractic and no distinctively different people, no specific group, and it was the ideal, because there was nothing in the literature emphasizing it, and because conditions that had had previous patient care with Palmer, the previous care with other allopathic groups, and I say allopathic group because all the rest are emphasizing some treatment procedure to alleviate symptoms and pain and discomfort. Palmer came along with another theory. He said this is the basic, fundamental, primal cause of disease, not diseases. I think he did say in the book of all diseases, not separating the difference. That was a little later on when he began to codify his understanding of it, that we can't say, or I can't say, and I can't endure if we've got all these pathogens that are known, that are recognized by the scientific community, that the new microscopes are seeing and studying, and the new germ theory that has come out. Everybody is focalized on this new theory. We're saying that this is a prime cause, or the cause. That won't endure. So we changed it, Palmer did, from disease to disease. And that split has ensued over the years. But it was done in an effort to keep people into this idea because the principle was relatively unknown. Now, we have to look at it realistically, too. That we go back into Cambodian history, into Grecian history with Hippocrates and Galen, 400 years before Christ, the American Indians. All throughout history we have done manipulative procedures. There's nothing unique and nothing new. In fact, I saw a picture, a photograph of some sculpture in Greece in Galen's time, 400 years BC. Here was a guy on a rack and they were stretching his spine to do some traction. Then I looked into Cambodian literature. Here's a picture of a device and a machine that they're stretching this fellow on. And so manipulation, and then another one they were doing a lumbar roll. They had their back all twisted over, and obviously you're going to produce some relief in many instances. So it's not manipulation that Palmer was concerned about. And he's often said, our profession's forefathers often said, that we are not the first ones to talk about manipulative procedures or manipulation or the value of massage or the value of traction. But our profession became uniquely involved in the idea that individual and specific vertebrae could become displaced to the extent that the vertebrae were in a locked, fixed position. And so from that point on, you had dysfunction and disorder because the nervous system was involved. We can be thankful that there wasn't anything included in the scientifics or in the legislative process or in the journals that alluded to this. That was something new that Palmer said. Well, obviously he wanted to build a profession because he had an idea. And it worked out that way. And everybody that come in, there'd be a third of them to remain loyal to the new idea, to the new goals, and to the new objectives. Now, in our early definitions of chiropractic, we would talk about things natural. And by alluding to things natural, we kind of eliminated and circumvented and went around the natural therapeutic applications of homeopathic, osteopathic, naturopathic procedures, which were therapeutic in nature. They weren't for any other reason except to treat with it. Now remember, the allopaths were using the drugs. And a lot of our people think that, well, we are natural because we can't do it according to law. And that's in many instances true. The medical profession, the allopathic profession, the homeopaths, they never were recognized here or licensed. The naturopaths have been perhaps licensed in one state. But they were treatments to inject some kind of manipulative procedure, some kind of natural substance. And if it wasn't natural, remember, they would run right into the jaws of the allopathic profession with the drug approach. So a lot of those groups turned naturally to get around the legislative process that said the allopaths, who were very well licensed beginning in the 1920s and the 1930s, and sometimes we don't remember our own selves to look back in the history of organized medicine. In the 1900s, you didn't have to go to college to become a medical doctor. You did an internship. You got a friend who knew how to pull teeth. You would become a dentist. You could serve an apprenticeship. Study with him 6 months or pull a few horse teeth or cow teeth or whatever, a few humans. Then you could move out west or move up to Philadelphia or down here to Alabama, Muscle Shoals, or over to Louisiana, and you become a dentist. You put your sign up, dentist up here. You put a nice striped pole up there. You could become a surgeon, whatever. But you did it in an internship. If you had formal training, that was better. And we had people who were just interested in it. So I think we should be a little more tolerant, and we should be knowledgeable of what the chiropractic profession wants to do and attempts to do and why we are here, particularly when we are talking about Sherman over here. Sherman's trying to put on a particular point of view. The ICA has been trying to put on a particular point of view. The ACA has been trying to put on a particular point of view, and it's now at a sensitive area in our history. You're caught here in the middle of this thing, and you hear a lot about unity, and you hear about the merger of the ICA and the ACA. And we haven't recognized yet, if we merge ICA and ACA, what are we going to do about FSCO? What about the Federation of Straight Chiropractic Organizations? And if you merge the ICA and ACA, are you going to merge the Federation, the group? There's been no attempt to reconcile the differences between the CCE colleges or the differences between that particular group and the Federation group. Why hasn't there been any agreement to do that? It is pure and simple. It's a political one. We've got the CCE, the government recognized organization. Most of the colleges, except 2, are affiliated with CCE in some manner, primarily. Why? Because you go through the CCE process, you get accredited, you get government recognition, and you get the government loans that you got. Remembering Sherman over here doesn't have the opportunity and the blessing of the United States Department of Education because they cling to a specific point of view. So they don't get government recognition. 2/3 of you wouldn't be here or couldn't be here if it wasn't for the government loan application. That's the advantage of it. Now, one of the mistakes, in my opinion, when this, just a little bit of the history, the Sherman College was in the CCE before we were, before Life College was. They founded their college probably a year prior to us. And one reason we didn't move into the college direction, we had the dream for several decades. But Palmer College, the Palmer, Dave was still alive. You follow what I mean? And when he passed away, that changed our attitude on the inside. We didn't want to compete with Palmer. We supported Palmer College. When Dave moved on, they moved into a slightly different direction. It became time for us to move. Our first meeting out here in the Gilardi and the Sherman College was at the meeting we went to in San Diego or Albuquerque, New Mexico. And one of the things that you need to know is that Sherman College, being in the CCE, failed in their first attempt to get accredited. At that time, we had 3 levels of accreditation: correspondent, recognized candidate, and full accreditation. Well, they failed the Sherman College because Sherman couldn't adapt. They didn't know how to handle the diagnostic posture. They didn't know what to do with diagnosis. And we've got to remember, too, that this thing was so heavily politically activated and motivated at that time. This is how it was. There was no federal agency recognized for chiropractic. Well, we had the 2 opposing poles, ICA and ACA, at this time. We needed to have one accrediting agency in order to get it accredited. If you can imagine all of these years, the accrediting agency for chiropractic was never accredited because we had 2 different accrediting agencies. Well, it came time, and I point this out in my little red book, The Final Push. You should get it because it's got a lot of historical significance. That our group had a meeting. We were going to reconcile our differences and submit one application to the federal agency, the Department of Education. We, the chiropractic profession, were going to get one group, ACA and ICA. And I would think at that time probably we had 4,000 members, and ACA at that time probably had 8,000 members. I remember when the ACA split off from ICA, we had, with the old NCA, we had 5,000 members. They had 4,500 members. We were a little larger at that time. You follow? ACA, a group of our people, split off, and we lost a lot of members. We lost a lot of time, and we lost a lot of enthusiasm and a lot of dedication as we went forward. But when we got to the meeting, the ICA, and this is part of the history of this organization, when the ICA delegation got to the meeting with the ACA to reconcile our differences and submit one application, the ACA, who sponsored the CCE organization, had already submitted it to the government in the form of an application, only one. Now, I wasn't in the hierarchy at that time. I was probably an ICA rep. I was for several years, a decade or so. But ICA should have objected right away. They should have challenged it. They should have put in their application. But they were nice and didn't. So that left one accrediting agency in the federal government to be accredited. Well, the politics of it, ICA did nothing. ACA was aggressive and moved forward, and first thing you know, in 1974, the government recognized the Commission on Chiropractic Education as the accrediting agency for chiropractic colleges and schools. And their ideal and their drive at that time was to convert everybody to the ACA's way. Nothing was changed in their original documentation. The ACC was ours. American Commission on Education was our particular view. The CCE was the ACA's, remember. Well, it became a great conversion process, remembering that they had, at that time, already accredited Los Angeles College and the National College were fully accredited already, and the rest of them had some kind of status. Now, what did that do? The moment that CCE was accredited by the government, the colleges that I just alluded to, the ACA colleges who were already accredited, who were already recognized candidates, or who are already in the process of correspondent status, what did they do with their students? The government immediately stamped all of these people as being certified to get student government loans because of their accreditation process of the new organization. The Palmer College, the fountainhead of chiropractic, was not accredited, did not even belong to the CCE. The Texas College wasn't accredited. The Logan College wasn't accredited. The New York College wasn't accredited. And the Cleveland colleges, 2 of them, weren't accredited because they didn't belong to the CCE. If it had been different, if ICA's organization had been in, if ICA had prevailed and put their organization in too, we'd have still had a dichotomy, and you wouldn't be here, probably, if we'd had 2 agencies, or the continued war would come along. But you can look back at that moment when the agency was organized. The ICA have always had twice the number of students, twice the number of schools as the ACA schools. Always have had. But when this came along, when the government accredited the CCE, they were in the driver's seat. None of the ICA colleges were accredited or on any level of correspondent, which is a very low thing, which gives you the authority to come in and get recognition, your students to get approved, you to be certified as having status. Well, that put every ICA college in a compromising position. Because here was the standards. We were looking at NCA standards. We were looking at ACA standards. We were looking at a long-term organization who was leaning toward allopathic medicine all of these years. And there was these schools that I named off, including us. And the Sherman College over here, which was the other 2. We came in, and then just before, I think it was the 2nd or 3rd meeting, there were the colleges under duress, and they did not allow in this early moment of the CCE's history. In fact, this went on for 5 years. They were so strict and so rigid and so demanding, as young bureaucratic organizations are. They needed the power and they wanted the power, that it was impossible for the college presidents to discuss any of the problems. We weren't allowed to even have a meeting with each other. It was 2 or 3 years into the process before we even organized a College Presidents Association because of the insistence of the CCE. No college presidents get together. That left us out there. We were all separated and divided. This was the process that they were going through to make the conversion complete of chiropractic. Now, if you could look back at it, that could have been changed if you'd have had the knowledge that we have of it today, the direction that we have of it today, the codification of the chiropractic principles. You could have converted the profession around to where it would be uniquely qualified in chiropractic's own principles, but it didn't happen that way. Back to Sherman now. Sherman failed to meet the criteria in 2 or 3 areas, and frankly, from a political standpoint, they didn't understand it. They were using, and we were using, when I say we, the Palmer College, the Cleveland colleges. There was only one Palmer College at this time. They were using not a diagnostic base, so don't think we're too far down on this diagnosis thing. The Texas College, the New York College, the Logan College, the Palmer College, the 2 Cleveland colleges were not using, prior to 1974, the professional base of diagnosis like you hear about it and like we emphasize it here. They used an analysis. It was the chiropractic analysis. That's how we grew up. That's how the entire profession was. That's how the majority of the people out here viewed it. Cleveland over here, not Cleveland, but Sherman, apparently wanted to look at it and to continue on that tradition with just the analytical base. To us, to me, professionally, if you look at it, if you take a patient off the street, if you're going to be in a community with other professionals, all of which have some type of and some form of diagnostic responsibility, form of diagnostic training, we must also have that same ability and capability if we are to be a primary provider or otherwise. One of the mysteries, one of the stumbling blocks that I had in my early career of chiropractic, like you, because we didn't, as I mentioned at Palmer, we didn't talk about any diagnosis. Every case was a chiropractic case. And the end of the dogma, when you take every case off of the street, and also remembering at this stage you start saying, my God, how did we get here? We are here because of the power of the profession, the power of the adjustment. That's the only reason we are here. We didn't have anything else. Nothing else mattered. When Dr. Humber and Dr. Nail and I went to college, Dr. Hitchcock up here, high school diploma, or its equivalent, a 3-year education of 6 months, that equated out to 18 months. How did we get licensures all over? It's the phenomena of the American political scene. People were failures under allopathic procedures, homeopathic, osteopathic, naturopathic procedures. They were failures of these procedures. Well, in our system of government, if you don't have a license, when you base it on, if you in fact say we don't diagnose, there was something about the laws at that time that the chiropractors didn't move into it. They could have moved into diagnosis in the early days if they'd have said diagnosis in a specific area of expertise for a specific reason that did not include full body diagnosis of diseases, the exact posture you have today, the exact posture that the majority of the CCE colleges has today. And you hear a lot about the diagnosis at Logan, the diagnosis at the LACC or whatever. Under no circumstances would their credentials, whatever training they would have in any of these institutions I've mentioned, would their training give them credentials further than yours? Because they too, when it comes down to the ultimate end, they cannot present eminent qualifications to diagnose diseases in the full body. Now, to recognize the diseases, yes. To have a responsibility for the total body, yes. I would think your perspective, the diagnosis of our area of expertise, meaning structural implications, the structural impact, osseous structure, even to the entire osseous structure, we would be more capable than the average specialist out here, orthopod. You go out to chiropractic, into some chiropractic diagnostic procedure with an orthopedic surgeon or a specialist in some manner, you are far superior to knowing the structural approach. But on the imminent end of it, the diseased entity, the processes removed from the spine and the structure, removing the subluxation, you'd be weak and insignificant, and it would require 2 years internship. And to become an orthopedic specialist, it would require from 2 to 4 to 6 years additional training. If you took what you had and got it equated, 2 to 4 years more in the classroom setting. 2 years minimum internship. Probably 2 additional years to qualify you as a specialist in orthopedics. So it's a miracle that we finally evolved out with all the distortion and the problems that we've had to have a profession that's recognized that to do basically one thing. And we hear a lot of criticism, but all I am is a subluxation fixer. Let me tell you, if you took the subluxation and its impact out of chiropractic, you don't have a thing. Nothing. Nothing unusual. You're right back to the same medical, therapeutic, orthopedic, allopathic procedures that have been existing. Our impact, our miraculous appearance on the scene, maybe it was divinely ordered, who knows? Something caused it to work. The licensure in all these states, the Chinese over here, the Cambodians wanting our work, not the broad aspects of the comparing credentials with orthopedic surgeons. They want chiropractic work on a very specific emphasis. What does this subluxation, that is the chiropractic, refers to it? What impact does that have on the potential of the human race, of every vertebra? What impact does that have? That's why we are gaining in significance. That's what the disagreement is in chiropractic. It's really no real fundamental disagreement, because the other side, the ACA, the NCA, have always adjusted subluxation. But it's the emphasis, the academic requirements at this time, the licensure requirements, the eminent qualifications, the internship in the clinic over here. If we don't watch ourselves, the fact of the matter is, I've often talked, maybe not to this group, I've been warning you and warning the chiropractic profession of those among us. Now, there's a scriptural truth I can't remember. There came amongst us those who sowed tares amongst the wheat. Now, there's some tare sowers out here in chiropractic. In Florida right now, 2 or 3 days ago, I got the word Monday, or maybe last Friday at 2 o'clock in the afternoon, that we're going to put in a nice, comfortable law in Florida requiring 3 to 4 months, 400 hours, internship in a doctor's office at an approved program by a CCE college, with your recent third requirement of the national board, clinical proficiency. Now Florida has seen a fit after 60 years. Now we're going to put in a nice requirement that you have to put another barrier up to prevent you from being licensed, to cause another stumbling block, for the only reason it could possibly be was to restrain it, to keep the growth down, to curtail the growth, to discourage. Now, the thing I've been speaking about, somebody, when they come out here with the broad body aspects, see, this is nothing but an economic thing. I don't know how many of you plan to go to Florida. I don't know whether it would be a grandfather clause, but I know this, that it's come out of the committee. It's my understanding of it. The chiropractors in Florida had to be behind it and support it. The Association of Florida had to be behind it and had to support it because it came out of the committee. And what they're going to do with it, I don't know. I don't know what you to do with it, because I have nothing from just one source in Florida that's concerned about it. It appears that everybody would say, of course. One of our graduates, I met him in the Orlando airport here not too long ago. I said, how you doing? Fine. He said, well, I've only got one problem. I said, what is that? He says, there's too damn many chiropractors in Orlando. I said, there's one every 500 feet on the way out to the airport. I said, well, that's good. You got all these people. He said, I used to say that till I got out here and saw how many there was. Now, are we ever going to change that attitude of what we do to ourselves? Just take a shotgun and not just shoot yourself in the foot, just blow it off. Because somebody, one of these days, when that, if that prevails in Florida, if it catches on, and see, this whole CCE process, we had nothing about the CCE, and you don't know all this. No mention anywhere in any state organization about having to be graduated from a CCE-approved college. The ACA did that. They wanted a power. I can't blame the bureaucrats. Bureaucrats usually only got anything but power. That's his structure. Give him more strength, and they gobble up this power all the time. So they went to the Federation of Chiropractic Examining Boards, which is dominated at that time by the American Chiropractic Association. Dominated. Because they wanted broad-body treatment. And our people out there, the basic fundamental ICA people, like you, are so concerned with serving people, so concerned and infatuated with chiropractic. I mean, it's so intriguing, so exciting to think that we got a basic cause that medicine doesn't recognize. There's something exhilarating about that, to think that all of this academic community who spends trillions of dollars can't come to a rational approach in their minds, that there's a new idea around, that there's something new, there's something significant, there's something different that's never been done before. There's something that exhilarates a real principled chiropractor. Like you people here who are not so interested in upper cervical, you should be vitally interested in the upper cervical approach. Can you imagine having the power of this whole universe, you knowing a fundamental thing that can be done to people to make them more proficient without any stimulation or any inhibition, without offering any change, any psychological approaches or anything, that you do a particular maneuver that would allow the divine, which is in us, around us, everywhere, omnipotent, to express itself in this being, having a key to unlock that, and we not being interested in the imminent idea of how to make that possible. We argue about an instrument. I don't even know the name of it. We talk about why should we do that? Well, I look at it like I can't imagine a professional student not wanting to buy the best instrument to determine whether or not that patient, when they leave the adjusting table or leave a person's office, does the patient continue to suffer with some kind of distortion in the system, the nervous system, the osseous structure? Is there some kind of fixation there that would prevent that being from expressing himself normally, that retards the homeostasis? Can you imagine getting onto an airplane out here and the pilot says, look, I don't want this crappy, outdated, this instrumentation called radar. I don't want any of that. I'm a good pilot myself. I'm going to do some motion palpation with this plane. I'm going to do some palpation. I'm going to do some vital checks to the ilium and the sacrum. I'm going to even lay the hands on a little bit. I'm going to take off to New York, and there's nothing but an increased downswing of the jet stream here, and we're going to go through a cloud mass that's 20,000 feet and reeked with thunderstorms. And I'm not going to use any radar. I'm going to just zip right through that thing. And you're on the plane, you hear the pilot discussing. I don't believe in any instrumentation. Why should I have to study it? Why should I have to take these patients? We should all go wash our brains out. You should be demanding and commanding more scientific instruments. What about microwaves? What about the latest instrumentation? How can we determine it? I don't mean just a motion palpation. What's that got to do with it? Motion palpation is fine. What did it do to the subluxation? What about your upper cervical specific? Can you, with a surety, or while you're education, with instrument, with x-ray, with the cine unit that we're putting in over here, can you with absolute certainty make sure that the foramen magnum is clear? Do you know how to clear it? I don't mean just pop the bones. I'm speaking about a life and death situation, which is every case. Every case presents himself to do is life or death. Premature or natural. Do you have the manual dexterity, the diagnostic skills, the technical skills that can place that person or can use an x-ray, that can show the points of interference? Do you have an instrument that you can run up that can even show any deviations? Will your palpation show that? Will your orthopedic test show that? With your guru in the field out here that doesn't use this thing. I don't like field gurus either. You've got enough gurus. Make one of these teachers over here your guru. Nowhere in no other profession, the gurus are in the colleges. They're not out here on the street corners. Every time we get a new guru in town, he don't want to depart information. He wants to build a flock to sell you his stuff. You follow? I'm a field guru too. I know we want believers down here at DE. You follow? I can tell you from how it is. We want believers. We don't come up here and harass you all the time, however. You know, look into your conscience. Do you know? That was what my consideration was when I was a student in your place. How am I going to know when that patient's lying on the table up here, or he's got a fever, or whatever there might be? Because I went into one of the cellars in Davenport. That's where all our patients were. Nothing in a strata that lived on the ground floor would go to a chiropractor. No, you had to live in a cellar, be low-class type. Went out on this guy in the cellar, and the fellow read him with the neurocolometer. The reading never even moved. It was just straight up, just like the guy had a pound of medicine or some kind of narcotic. He read it twice. I saw it right behind him. It never even budged. It went straight up. He said, "Fine, you're clear." The guy had 104 fever, apparently, because his wife said he's running 104. The chiropractor never said, "Boo, hello, what's wrong with that?" He said, "He's checking clear." I thought to myself, I'm getting in this profession here. What am I going to think when this guy is checking clear? I thought he ought to have been in the hospital. He'd been near comatose for a week. How long has he been here? 3 weeks. I said, "What's wrong with him?" He has a vertebral subluxation. I said, "Sure enough, what's really wrong with him?" He said, "He's got a vertebral subluxation." I'm a chiropractor. He said, "His innate's going to take care of him." I said, "Oh my God, got this innate thing out here now. His innate's going to take care of him." There he is lying on the bed with 104, and you read him and you can't even tell it doesn't move at all. He never checked his leg, never had an emotion palpation. I'm nothing. I wanted to know. I don't know whether you've ever thought about it or not. Maybe you prefer some additional treatment procedures that you can treat this guy with, or this patient. But behind it all, the security of knowing you have done what you have done with your hands, with this neurocalligraph, or your motion palpation, or your massage, or your laying on of the hands, or your activator, or whatever you got. What's the basis behind it? That was my concern. And I'm sure you must not be fully alerted to it. It took me 22 months, and I wore the cover off of BJ's green books. Just wore them out, just fell off of it. I couldn't find it in the books. I certainly couldn't find it in osteology, orthopedy, astrology, whatever. I think I said astrology, didn't I? I couldn't find this answer to it because I was insecure with no diagnosis. And all of the medical profession, I had to have respect for the medical doctors. You must have a certain amount of respect for the medical doctor. And they say, here's what you're up against. They say that it's totally unprofessional and unscientific in the face of trillions of dollars. I hope this shames you and gets to your heartstrings inside. They say that it's unprofessional, irresponsible, sheer quackery that you would use a massage, a manipulative procedure, or herbs, or hot packs, electrotherapies of all sizes to deal with a real sick person. Now that's the essence of it. Or have we gone so far in chiropractic that we think that chiropractic treatment, don't you use and don't you hear a lot, and nearly everything you read coming out of the American Chiropractic Association is some kind of chiropractic treatment. There is no such thing as chiropractic treatment unless you view the adjustment as a treatment, something we never did. And you're going to apply your treatment, catch this, your treatment of ultrasound, dial pulse, med-consolators, herbs, vitamins, massage, psychological treatment procedures against the entire world medical allopathic establishment that has set standards of care for this diseased entity that this patient is suffering from. How are you going to deal with that? That's the question. How are you going to deal with it spiritually and emotionally and professionally in your own mind? I'll tell you how there's a lot of the, quote, modern doctors are going to deal with it. Like the couple of the colleges I mentioned before, they are training their doctors. They're training the youth in our profession, training you to recognize with their diagnostic skills, quote, medical entities, medical diseases for the purpose of referring these entities, this patient on the bed that been there for 3 weeks, for the purpose of referring that patient out for proper medical care. Is that where you're building your success on? Where you can name the diseases? And remember, every disease has got a treatment. They got trillions of dollars over here. Worldwide, they've had them for the last 50 years. Trillions. Is that what your diagnostic skills are for? So that you can eliminate diseases that you're not supposed to take? So that you can rule out all the possibilities that a person could be suffering with so that he can have the proper treatment? You know what this little instrument is supposed to be for? What any instrument in chiropractic is for? Determine whether or not the vital force has been reactivated, unblocked. Is the vivification process, the creative process, the innate process, if you prefer that particular name, life process. You know, you go looking into the text in some research journals on vivification or the innate natural healing processes, you know that's non-existent. You know that we know no one ever tackles life. No one ever studies what you're studying right now. No one gives a damn whether or not life is blocked off. Motor energy, Galen knew that. Hippocrates knew that. All the scientists have known motor energy activates the nerve, and the nerve activates the muscle and causes all the organs to function. What about life? What about the principle we are talking about? The principle. You think this is paganistic, eh? You watch it, it comes down every time. That's a fundamental law. Fundamental. All the rest of the hypothetical theories about life, about spirit, about God, about the universe, about the hereafter, the pre-after, the preliminaries, can only talk about it when it comes through the intellectual mind, what they feel. We got life all to ourselves. We say that the creative energy that makes this world, imagine the staggering, look at the moon up here tonight. On and beyond, we've got a little robot, been in space 20 years. We're still in contact with it, and it's still moving. Can you imagine the magnitude of that? We're still looking for those other beings out there. We're still looking for others in another world. We've tapped that. This profession has tapped that, and we're the only ones that even approaches it. We say that life, properly expressed, will produce a change toward normal in the homeostasis. It changes the educated man, the physical man, the spiritual man. We say it's a bigger idea than medicine, who treats. Can't you know that we do the ideal, the real, armed without instrumentation, without an interest from our students, without even an interest? Why don't I hear any philosophy talks? Why don't we argue and complain and philosophize and talk about where this life is? Where does it go? Can't you talk about that, or you have to go to church to find that out? Call the Pope. Call Falwell up here. Let him tell you. We say the physical is part of our professional capabilities, and the spiritual. But we've left it out. Nobody has ever researched the principle, the spiritual quality. Nobody's ever brought them together. Chiropractic brought them together. That's why you're here. To come to an understanding of what do you think, what goes through your mind. Do you know what you've done when you've made the adjustment? Have you just freed some nerve energy? Is that all you've got? No damn wonder you don't sleep good at night. Can you imagine taking a person with all the known diseases in the world, including AIDS or whatever? Every new disease comes along, we got the same answer. AIDS is a little bit different. You stay unexposed and stay in adjustment, you're safe as you can be. I even heard the other day that AIDS virus into normal channels like saliva, that it doesn't affect it. The saliva destroys the AIDS virus. You talk about getting the rectal canal, the columns of Morgane tangled up with the AIDS virus, and it makes them grow like fertilizer. That's abnormal. That's abnormal, and it's not saliva. I know about some saliva treatments are a little abnormal. You're talking about how to prevent AIDS. I don't say we cure AIDS, but you stay away from the AIDS thing. And stay in adjustment and watch what happens. No AIDS. There's another disease created every day. There's thousands and thousands and thousands and thousands of different diseases. Are we going to have to recreate a new drugless approach to the treatment of the new diseases? Or do we stand on the supreme? Can you imagine? Oh, the scientist says, we've created a new metal. Even God doesn't know about the metal. The law of gravity has not yet had a council meeting. God has not had the committee meeting yet to decide what to do with this new substance. Or is it known automatically when you create this new substance, or does the Supreme know it already and actually participate in the creative process? Is that where we are? Is that where we are? Are you ashamed to tell that to your preacher out there, your Sunday school teacher, or your layman that comes in? And you have to use the right language. You can't talk about the columns of Morgane and go down crisscrossing and surging the life force down through the medulla oblongata. You can't talk that way to your patient. Talk about a dog stepping on you're stepping on a dog's tail and he's barking out of his mouth and that sort of thing. Little simple things. When you're explaining your car, I'm not talking about you, the state board. Don't talk about stepping on the dog's mouth, he's barking out of the mouth, so what's wrong with my back? So, well, you're being stepped on up here and you're barking down here. All that's very simple and paganistic, but I understand it that way. This patient, do you understand? You got 2 minutes, by the way, don't get nervous. I'm going to close you out so close to 12 o'clock you're not even going to believe it. No nervousness, no walking out, no checking your cards, none of this filling out. And there's 2 or 3 guys over here that knows a hell of a lot more than me because they've been carrying on a nice conversation. I wish for them in 5 years that they're still just as damn negative that I'm talking about. Negative! Because you can't use drugs. And you're not sure of your x-rays. You took an old distorted x-ray picture. You could take one just as good with a 20/60. What are you going to do with that sick person? What's your belief? Your knowledge capsule? Do you know life? That's what you're here to assume, to assimilate. The faith in what to do with that patient that is correct. That you do, in fact, know the primal, basic, fundamental cause of that sick person. And you don't even have to know the name of it. Did you know that? Innate knows it. That may sound paganistic, but the truth is the truth. Nothing outside this environment impresses that patient like the innate. The natural flow inside the patient. Interrupt that flow. And what do you get? Disease. And sooner or later, you get diseases. That's how easy it is. And all of the medical community, ignorant as they are, biased as they are, prejudiced as they are, spent billions to wipe people out like you, exterminate you, worse than the Nazis. Worse than the Nazis. Now put that in your pipe when you go loving one of these autopaths out here. They want you eliminated because you conflict. You conflict with their pet theories, and you've taken money out of their already overinflated bank accounts. That's what your challenge is. You're here to replace the medical doctors. And you've got to have enough strength and enough dedication and enough courage to go and do it. Give me a pie, a strong high pie. Now don't just run out here and just give me an old flip-flop. You'll flip-flop in practice. This thing ought to be your signal. Get you some Life College things on the back of your car. A lasting purpose. I don't see any LP pens out there. That means love, serve, and give out of your own abundance where you can convince a patient. Is your hands heavy? Put your hand up here. Your hands are not heavy. You should be able to cock that thing and walk around all day long without breaking an arch. Look, I got a relaxed arm right now, but my arch is full. Turn out, I can flip my pie. Put your hand up. You tired? All right. Now, when somebody asks you how you're feeling, hands up here. Come on. You tell them near perfect. How do you feel? Near perfect. All right. I say I feel healthy, and I feel happy, and I feel terrific. 1, 2, 3.
I feel healthy. I feel happy. I feel terrific.
Get a hand up there. With this, it's trained. If you'll put the energy into the subluxation and come out quick enough, innate of the patient will seat the vertebrae. And you let that crisscrossed energy surging back down through the medulla into the body heals. It don't make any difference what it is. Give me a hand up, young lady. I'm going to have to give you all some exercises. Now give everybody in here a high pie. I love you and I appreciate you, and I'll see you next week. And high pie. Thank you.
Real hot, Doctor.